Question 1. A patient is diagnosed with essential hypertension. According to the ICD-10-CM guidelines, how is this condition typically coded? A. Code hypertension as secondary. B. Code hypertension as controlled. C. Code hypertension as essential, primary. D. Code hypertension as malignant. Answer: C. Code hypertension as essential, primary. This question tests your understanding of coding essential hypertension in ICD-10-CM. Essential hypertension is the most common type, meaning it has no identifiable cause, and the keyword essential is the primary clue. ICD-10-CM presumes hypertension is essential unless documented otherwise as secondary or malignant. When you look up hypertension, the main entry points you to essential hypertension codes unless more specific documentation is present. For example, if the documentation simply says hypertension, you would report the code for essential hypertension. Always default to essential hypertension unless the provider specifies a different type. Question 2. Which anatomical plane divides the body into anterior, front, and posterior, back, sections? A. Transverse plane. B. Sagittal plane. C. Coronal, frontal, plane. D. Mid-sagittal plane. Answer: C. Coronal, frontal, plane. This question is about understanding anatomical planes, which are imaginary flat surfaces used to divide the body or organs for descriptive purposes. The keyword anterior and posterior sections directly points to the coronal or frontal plane. A transverse plane divides the body horizontally into upper and lower portions, while sagittal planes divide the body vertically into right and left sections. For instance, an MRI might show images cut along the coronal plane to view structures from the front or back. Remember that the coronal plane is like wearing a crown, it splits you into front and back. Question 3. When coding for evaluation and management, E/M, services using the 2021 and later guidelines, which component is considered a key element in determining the code level for most office visits? A. Time or medical decision-making, MDM. B. History and exam. C. Chief complaint. D. Review of systems. Answer: A. Time or medical decision-making, MDM. This question focuses on the key components used to determine E/M service levels under the updated guidelines for office visits, effective 2021. The significant change highlighted by the question is the shift from requiring 3 key components, history, exam, MDM, to primarily focusing on just 2, time or medical decision-making. While history and exam are still documented, they no longer automatically determine the level for office visits. For example, a complex patient with a detailed MDM but a brief history and exam might still qualify for a higher level E/M code based on MDM alone or the total time spent. Remember that for most outpatient E/M codes, you choose the level based on either the total time spent or the complexity of the medical decision-making. Question 4. A patient receives an injection of 10 mg of a drug that has a HCPCS Level II code with a dosage of 1 mg per unit. How many units of the HCPCS code should be reported? A. 1 unit. B. 5 units. C. 10 units. D. 100 units. Answer: C. 10 units. This question tests your ability to calculate units for HCPCS Level II drug codes. The core concept is understanding that HCPCS drug codes specify a dosage amount per unit, e.g., 1 mg equals 1 unit. The keyword here is the 1 mg per unit dosage specified by the HCPCS code and the 10 mg administered. To find the number of units, you divide the total dosage given, 10 mg, by the dosage per unit, 1 mg per unit. For instance, if the code was for 5 mg per unit and 20 mg were given, you would report 4 units, 20/5. Always divide the total dose by the units listed in the HCPCS code descriptor. Question 5. What is the term for a malignant tumor arising from epithelial tissue? A. Sarcoma. B. Lymphoma. C. Carcinoma. D. Melanoma. Answer: C. Carcinoma. This question tests your knowledge of basic medical terminology related to tumors and tissues. The key concept is the origin of the malignant tumor. The keyword epithelial tissue is the clue pointing to the correct answer. Carcinomas are malignant neoplasms originating from epithelial cells, which line body surfaces and cavities. Sarcomas arise from connective tissue, lymphomas from lymphoid tissue, and melanomas from melanocytes, a type of epithelial cell, but melanoma is a specific tumor type. For example, squamous cell carcinoma is a common type of cancer arising from the squamous epithelium of the skin. Knowing the tissue origin helps you classify tumors correctly. Question 6. According to CPT guidelines, what is considered a modifier? A. A 5-digit code that describes a service. B. A 2-digit code appended to a CPT code to provide additional information about the service. C. A code used to report durable medical equipment. D. A code used for diagnosis reporting. Answer: B. A 2-digit code appended to a CPT code to provide additional information about the service. This question defines a modifier in the context of CPT coding. The key concept is what a modifier does and its format. Modifiers are 2-digit codes that are attached to CPT codes to indicate that a service or procedure was altered by some specific circumstance but not changed in its definition or code. They provide payers with additional necessary information without changing the CPT code itself. For example, modifier -25 is used when a significant, separately identifiable E/M service is performed on the same day as a procedure. Modifiers explain the why or how of a service without changing the base code. Question 7. A patient presents with pain in the lower back that radiates down the leg. The provider documents sciatica. In ICD-10-CM, how is sciatica typically classified? A. As a disorder of muscle. B. As a disorder of nerve root and plexus. C. As a disorder of bone density. D. As a disorder of joint. Answer: B. As a disorder of nerve root and plexus. This question asks about the classification of sciatica in ICD-10-CM. Sciatica is pain radiating along the path of the sciatic nerve, which branches from your lower back through your hips and buttocks and down each leg. The keyword sciatica and the description radiates down the leg point to a nerve-related issue. In ICD-10-CM, sciatica is indexed under disorders affecting nerve roots and plexuses, often linked to conditions like lumbar disc disorders. For example, sciatica due to a herniated disc would be coded with codes reflecting both the disc disorder and the associated sciatica. Sciatica is fundamentally a nerve issue, not primarily muscle, bone, or joint. Question 8. What is the primary purpose of the National Correct Coding Initiative, NCCI, edits? A. To identify fraudulent billing practices. B. To promote correct coding and control improper coding leading to inappropriate payment. C. To determine medical necessity for services. D. To establish fee schedules for medical services. Answer: B. To promote correct coding and control improper coding leading to inappropriate payment. This question asks about the purpose of NCCI edits. The core concept is what these edits are designed to achieve in the billing process. NCCI edits are automated claim edits developed by the Centers for Medicare and Medicaid Services, CMS, to prevent improper payment when certain codes are submitted together. They primarily focus on preventing unbundling, reporting multiple codes for services typically included in a single code, and ensuring mutually exclusive procedures are not billed together. For example, NCCI edits often bundle codes for minor procedures into larger procedures performed at the same time. NCCI edits are a crucial tool for ensuring the accuracy and integrity of Medicare and Medicaid coding and billing. Question 9. A patient undergoes an excision of a malignant lesion from their arm. According to CPT guidelines, what is included when measuring the size of the excision for coding? A. Only the size of the visible lesion. B. The size of the lesion plus the narrowest margin required for complete excision. C. The size of the lesion plus the widest margin taken. D. The size of the defect after excision. Answer: B. The size of the lesion plus the narrowest margin required for complete excision. This question tests a specific CPT guideline for coding lesion excisions, particularly malignant ones. The key concept is how to correctly measure the size reported for excision codes. CPT guidelines state that the size of the excised malignant lesion is determined by measuring the greatest clinical diameter of the visible lesion plus the narrowest margin required for complete excision documented by the physician. This ensures that the code reflects the total amount of tissue removed to clear the malignancy. For instance, if a lesion is 1 cm and the provider takes a 0.5 cm margin on each side, the size reported is 1 cm plus 0.5 cm plus 0.5 cm equals 2 cm. Always include the narrowest margin with the lesion size for malignant excisions. Question 10. In medical terminology, what does the suffix ectomy mean? A. Surgical repair. B. Surgical removal of. C. Surgical creation of an opening. D. Surgical puncture to remove fluid. Answer: B. Surgical removal of. This question is about understanding common medical terminology suffixes. The core concept is the meaning of ectomy. This suffix is frequently used in surgical procedure names. Ectomy consistently indicates the surgical removal or excision of an organ or part. For example, an appendectomy is the surgical removal of the appendix, and a tonsillectomy is the surgical removal of the tonsils. Recognizing common suffixes like ectomy is fundamental to understanding medical procedures described in documentation. Question 11. A coder is assigning a code for a burn. In ICD-10-CM, what information is essential for accurate burn coding? A. Site, degree, and percentage of body surface involved. B. Cause of the burn and patient's age. C. Whether the burn was initial or subsequent encounter. D. All of the above. Answer: D. All of the above. This question asks about the essential details needed for accurate burn coding in ICD-10-CM. Burn coding requires multiple pieces of information to select the most specific codes. You need to know the anatomical site, the severity, degree first, second, third, the extent, percentage of total body surface area burned, the cause, e.g., fire, chemical, whether it's the initial treatment or follow-up care, encounter, and sometimes even patient age for specific guidelines. For example, a third-degree burn to the hand, site, degree, involving 5% TBSA, extent, from a fire, cause, being treated for the first time, initial encounter, would require codes capturing all these details. Accurate burn coding depends on capturing all documented specificities. Question 12. What is the primary purpose of HCPCS Level II codes? A. To report physician services and procedures. B. To report durable medical equipment, supplies, drugs, and other non-physician services. C. To report diagnoses and diseases. D. To report hospital inpatient procedures. Answer: B. To report durable medical equipment, supplies, drugs, and other non-physician services. This question focuses on the scope and purpose of HCPCS Level II codes. While CPT, HCPCS Level I, primarily covers physician and other healthcare professional services and procedures, HCPCS Level II fills the gap by coding products, supplies, and services not included in CPT. Keywords here are HCPCS Level II. Examples include ambulance services, medical supplies like bandages, durable medical equipment like wheelchairs, and injectable drugs administered in an outpatient setting. Think of HCPCS Level II as coding the stuff and some non-physician services used in healthcare. Question 13. When coding an E/M service, what does medical decision-making, MDM, represent? A. The total time spent with the patient. B. The complexity of establishing a diagnosis and/or selecting a management option. C. The extent of the physical examination performed. D. The comprehensiveness of the patient's history. Answer: B. The complexity of establishing a diagnosis and/or selecting a management option. This question defines medical decision-making, MDM, in the context of E/M coding. MDM is one of the key components used to determine the level of an E/M service, particularly under the newer guidelines emphasizing time or MDM for outpatient visits. MDM assesses the complexity based on three elements: the number and complexity of problems addressed, the amount and/or complexity of data to be reviewed and analyzed, and the risk of complications and/or morbidity or mortality of patient management. For example, managing a patient with multiple chronic conditions requiring review of extensive records and high-risk treatment involves high-complexity MDM. MDM is about the cognitive work involved in managing a patient's health. Question 14. What does the term pathology primarily involve in medicine? A. The study of the structure and function of the body. B. The study of diseases and the changes they cause in the body. C. The study of medical imaging techniques. D. The study of medications and their effects. Answer: B. The study of diseases and the changes they cause in the body. This question asks for the definition of pathology. Pathology is the branch of medicine concerned with the cause, origin, and nature of disease. Pathologists examine tissues, cells, and body fluids to diagnose illness. For example, a biopsy of a tumor is sent to pathology for microscopic examination to determine if it's cancerous. Pathology is essentially the study of what goes wrong in the body when you are sick. Question 15. A patient is diagnosed with strep throat. In ICD-10-CM, this is a common term for which type of infection? A. Viral pharyngitis. B. Acute bronchitis. C. Streptococcal pharyngitis. D. Influenza with sore throat. Answer: C. Streptococcal pharyngitis. This question tests your knowledge of common medical terms and their corresponding ICD-10-CM classifications. Strep throat is the common name for a specific bacterial infection. The keyword strep is short for streptococcus, the type of bacteria that causes the infection. In ICD-10-CM, strep throat is coded as streptococcal pharyngitis. For instance, if the documentation says patient has strep throat, confirmed by rapid strep test, you would code for streptococcal pharyngitis. Recognize common colloquial terms and their precise medical diagnosis. Question 16. In CPT coding, what does the abbreviation bilateral typically indicate when used in a code descriptor or with a modifier? A. The procedure was performed on the left side only. B. The procedure was performed on the right side only. C. The procedure was performed on both the left and right sides. D. The procedure was performed partially. Answer: C. The procedure was performed on both the left and right sides. This question is about understanding a common term used in CPT and with modifiers. Bilateral means affecting or relating to both sides of the body. When a CPT code descriptor specifies bilateral or is reported with a bilateral modifier, like -50, it indicates the service was performed on both the left and right sides during the same operative session. For example, a code for knee arthroscopy, diagnostic, bilateral means the diagnostic scope was done on both knees. Bilateral procedures are usually coded differently than performing the procedure on just one side. Question 17. Which part of a medical record provides the patient's personal information, such as name, date of birth, and contact details? A. Progress notes. B. Demographic information. C. History and physical. D. Operative report. Answer: B. Demographic information. This question asks about where to find basic patient identification details within a medical record. Demographic information pertains to the statistical data of a population or group, in this case, the patient. This section includes identifying details necessary for billing, scheduling, and communication. Progress notes document the patient's condition and treatment over time. A history and physical details their medical background and current state, and an operative report describes a surgical procedure. Always locate the demographic section for patient identity and insurance information. Question 18. What is the primary goal of accurate medical coding and billing? A. To minimize the amount the patient has to pay. B. To ensure healthcare providers are appropriately reimbursed for services rendered. C. To make medical records easier to read. D. To track the number of procedures performed. Answer: B. To ensure healthcare providers are appropriately reimbursed for services rendered. This question asks about the main objective of medical coding and billing. While coding supports various functions, its primary financial purpose is to translate healthcare services into standardized codes that payers use to process claims and compensate providers. Accurate coding directly impacts the revenue cycle. For example, using the correct CPT and ICD-10-CM codes on a claim allows the insurance company to understand what services were provided and why, leading to payment. The core function of coding and billing is to facilitate accurate financial transactions in healthcare. Question 19. According to ICD-10-CM guidelines, when a patient has both an underlying condition and a manifestation of that condition, e.g., diabetic neuropathy, which code should be listed first? A. The code for the manifestation. B. The code for the underlying condition. C. It does not matter which code is listed first. D. Only the code for the manifestation is needed. Answer: B. The code for the underlying condition. This question tests a fundamental ICD-10-CM coding guideline for conditions with both an underlying cause and a manifestation. ICD-10-CM has specific code first and use additional code notes to guide sequencing in these situations. The general rule is to code the underlying condition first, followed by the manifestation. For example, for diabetic neuropathy, you would code the specific type of diabetes first, the underlying condition, followed by the code for diabetic neuropathy, the manifestation. Always look for and follow the sequencing instructions in the ICD-10-CM codebook. Question 20. A radiology report describes a PA and lateral chest X-ray. What anatomical view does PA represent? A. Side view, lateral. B. View from front to back. C. View from back to front. D. Oblique view. Answer: C. View from back to front. This question relates to medical imaging terminology, specifically for radiology views. PA stands for postanterior, indicating the X-ray beam enters the patient's back, posterior, and exits through the front, anterior, to reach the film or detector. The keyword PA is the direct clue. A lateral view is a side view, and an AP, anteroposterior, view is from front to back. For example, a PA chest X-ray is commonly performed with the patient facing the X-ray plate. Understanding directional terms is key in radiology coding and documentation review. Question 21. What does the term comorbidity mean in a medical context? A. A condition that was treated and is now resolved. B. A pre-existing condition that coexists with the primary diagnosis. C. A complication that arises during hospitalization. D. The expected outcome of a disease. Answer: B. A pre-existing condition that coexists with the primary diagnosis. This question asks for the definition of comorbidity. A comorbidity is a medical condition that exists simultaneously with another, usually primary, condition. These conditions can influence the treatment and outcome of the primary diagnosis and are important for coding to accurately reflect the patient's overall health status and complexity. For instance, a patient admitted for pneumonia, primary diagnosis, who also has diabetes and heart disease, comorbidities, is more complex to treat. Accurately reporting comorbidities is essential for correct reimbursement and data analysis. Question 22. In the anesthesia section of CPT, what is the purpose of reporting qualifying circumstances codes? A. To report the type of anesthesia administered. B. To indicate difficult or unusual anesthesia services. C. To report the patient's vital signs during surgery. D. To report the specific anesthetic agent used. Answer: B. To indicate difficult or unusual anesthesia services. This question is about specific codes found in the anesthesia section of the CPT manual. Qualifying circumstances codes are add-on codes reported in addition to the primary anesthesia code to describe circumstances that significantly affect the character of the anesthesia service. They are used when the service is more challenging or complex than usual due to factors like extreme age of the patient or emergency conditions. For example, code 99100 is used for anesthesia for a patient of extreme age, under 1 year or over 70. These codes provide additional detail about the complexity of the anesthesia care. Question 23. A patient undergoes a colonoscopy where a polyp is removed by hot biopsy forceps. According to CPT, how is the removal of the polyp coded? A. Code the colonoscopy only. B. Code the colonoscopy with a separate code for biopsy. C. Code the colonoscopy with a code for removal by hot biopsy forceps. D. Code the colonoscopy and an E/M service. Answer: C. Code the colonoscopy with a code for removal by hot biopsy forceps. This question tests a specific CPT coding scenario for procedures performed during an endoscopy. When a diagnostic colonoscopy turns therapeutic, a polyp is removed, you code the therapeutic procedure performed. The keyword here is polyp is removed by hot biopsy forceps. CPT provides specific codes for polyp removal techniques during colonoscopy. You would use the code for colonoscopy with hot biopsy forceps removal, not just a diagnostic colonoscopy or a simple biopsy code. The code should reflect the most extensive procedure performed to remove the polyp. Question 24. What is the meaning of the root word cardio? A. Bone. B. Blood. C. Heart. D. Nerve. Answer: C. Heart. This question tests your understanding of a common medical root word. The root cardio consistently relates to the heart. For example, cardiology is the study of the heart, and electrocardiogram, ECG or EKG, is a test that measures the electrical activity of the heart. Recognizing this root helps you understand terms related to the cardiovascular system. If you see cardio in a word, you know it has something to do with the heart. Question 25. In ICD-10-CM, what is the purpose of the tabular list? A. To provide an alphabetical index of diseases and injuries. B. To list codes in alphanumeric order and provide instructional notes. C. To list procedures and services. D. To provide definitions of medical terms. Answer: B. To list codes in alphanumeric order and provide instructional notes. This question asks about the function of the tabular list in the ICD-10-CM codebook. The ICD-10-CM is divided into the alphabetic index and the tabular list. The alphabetic index helps you locate potential codes based on terms, while the tabular list contains the actual codes organized numerically and provides essential instructions, such as inclusions, exclusions, and coding notes. You must always confirm codes selected from the alphabetic index in the tabular list. The tabular list is where you find the complete code descriptions and rules needed for accurate code assignment.